Janice. Hello. I'm from Vancouver, but I'm here doing a practicum at Creston Hospital for 5 weeks. I'll be graduating in October from physiotherapy school, and I'm also have been a kinesiologist for a few years. And in school, we're involved in a hip fracture quality improvement project at VGH just to improve outcomes, because there has been shown to have a high mortality and morbidity rate after hip fracture. And pelvis fracture, I'll just mostly probably talk about hip fracture, but pelvic fracture is the same kind of concept. And I know you have a lot of those here. So called you caregivers. I wasn't sure to say care aides or whatever it was, but I think that's a nice name. So I just wanted to put it into some context and talk about what we want for our patients. So obviously we want safety. We don't want anyone to fall and hurt themselves, but we also want safe, independent mobility. So it's a lot easier for us if someone can transfer themselves or do their ADLs or walk to the bathroom and back. And I know everyone's always overworked, so the more patients we can have who are mobile, then the easier it is for us, the better care we can give to everybody else. And of course, best quality of life. So it's really unfortunate if you have to go through life relying on everyone else all the time and not being able to kind of just do what you want to do. So in terms of healing after hip and pelvic fracture, so the doctor or the physiotherapist will give orders about what's safe. So we can know that if someone is activity is tolerated, it's totally safe for them to do any movements. If there's anything that's not safe for them to do, the doctor is required to tell us. So we can trust those orders that we get. And in fact, bone is built up a lot more during weight-bearing exercises. Our body needs to be having that impact in order for the body to go and lay down bone in that area. So it really helps healing if we're moving around. So very old news that bed rest is good for us. So especially with this population, in the 50s, 60s, and 70s, we were taught that bed rest is good. That's the way that you get better. And a lot of people in the age group that has a hip fracture is still on that kind of news. But what we found is actually bed rest is the worst thing for us. Even if someone's been in a car accident and they have a lot of back pain, 2 days is the maximum amount of bed rest that is recommended for them. And in fact, even that is not necessary. So they did a study in the 1960s, which is the kind of study we're not allowed to do now, so I have to cite a really old one. They put some healthy young men on bed rest, and they measured everything about them to see what the effects were. And it was pretty terrible. So after 24 hours, that's only 1 day, they had lower blood plasma volume. So our blood is made up of red blood cells and plasma, and the plasma is necessary because when our blood fills the heart, however much it fills determines how hard it will push everything out. And so if we have less blood plasma, then there's less blood being pumped out per beat of the heart. And then what happens is the heart rate has to increase during those same activities because it has to beat more times since less blood is going out each time. So what happens is a person you kind of get used to how fast your heart beats when you do certain things. If you run, it's going to beat faster, and that's fine. But when people get up after a hip fracture, their heart is beating way faster than it normally does, and it's a little bit scary, and it kind of can make them not want to move even more. So the more we can limit those changes, the easier it's going to be to mobilize people. Another thing that happens is blood pools in the legs. In order for blood to get back to the heart, we need to have that muscle pump action. And so if people aren't moving, they get more edema down there, more swelling, and then also less blood is coming back to the heart each minute, and so it's going to have to be even faster for what it's trying to do, and so a whole cascade starts to happen. Another thing that happens after 24 hours, I'll explain what this is. A VO2 max is reduced by 27%, which is huge, and is dropping. So that just means the volume of oxygen that we're able to process per minute. If someone's an Olympic athlete, theirs will be at 90. They're really high. But a frail elderly person could be starting out with 20 or 25 VO2 max. And we have to have 12 to 15 in order to do our activities of daily living. So if someone's already coming into the hospital, starting really low, they have to wait 1 or 2 days for their surgery. They're already on bed rest for 2 days. They've already lost 27%. Then each day that we don't mobilize them, they're losing even more. And so this can prevent them from even having the physical fitness to walk down the hall all the way or make it up the stairs. And bed rest doesn't just have to be total bed rest, but if the rehab assistant or the PT comes in, we're only mobilizing someone for 10 minutes a day, maybe half an hour at the most. And if the rest of the time, the other 23 and a half hours they're in bed, that's pretty much being on bed rest. So we want to encourage people to get up to go to the bathroom by themselves. We want them to be moving around as much as possible. And then of course, after 2 weeks, they get reduced muscle and reduced bone mineral density. So for people who already have osteoporosis, this is really getting into the dangerous zone for them. So they've looked at studies of people who, like how soon they will mobilize after hip fracture, and they found even by delaying it by 1 day, they have poor function after 2 months, and many even die within the first year. The rates of that spike up. And so, and it's not just mobilizing the first time, but it's like every day how much they mobilize. So I just had a few screens on why does it hurt so that we can know what is safe for our patients and also reassure them. So if you've had a surgery on your fracture to get, screws put in or whatever else, however else they fixate it, you might have some bone pain. So the bone pain feels like aching at rest. So if it's aching at rest and it's going to ache when they move, then they might as well move because moving is a lot better for them. And in fact, weight bearing lays more bone down in the area. So if they have swelling, the reason swelling hurts is because it irritates the nerve receptors in the area. It stimulates those pain nerves and it feels like throbbing. So if someone complains of throbbing, then you'll know it's probably due to swelling. And in fact, movement pumps swelling out of the joint space. So our hip has a big capsule around it and there's fluid inside when there's damage inside. And the only way to get it out is through electrical stimulation or moving because it needs to be pumped out. So moving actually might make them feel better if they get up. If they have some sutures, skin pain feels like a burning or sharp sensation. When they start moving around, they may get a little bit of irritation there. If they complain of that, just let them know that that's normal, you're not damaging yourself, and in fact, it might stimulate the area to heal faster. And it probably hurts to lay on it, so you might as well get up. Muscle pain. Normally, they won't feel any muscle pain at rest. It'll only start when you move the muscles. So this is why pain control is important. Because sometimes people refuse their pain medication because it doesn't hurt when they're just laying there. But then all of a sudden they try to move and then they don't want to move because there's so much pain. So that's something to think about is if they're on a pain management schedule, just to make sure they're having some of that before you want to move them. So if they get increased muscle pain, it will stop as soon as they stop moving. So that's something you can point out to them, or if you're worried about it. When they sit back down, say, okay, now how does it feel? And they'll say, oh, I don't feel any pain. So that kind of makes people feel better about moving, is that they know it's going to stop as soon as they stop. Also what happens is it can loosen up tight spasming muscles. So when we're laying down for a long time, our muscles can really tighten up, and this can relieve that. Also, when muscles are healing, collagen has to come in and it lays down more fibers to get the ends together and to heal that muscle. But what happens is it does it in the like how you would sew on a button. So you sew it in all directions to make sure it's really stamped down and it doesn't fall off. But when we do that to our hip, then it restricts our movement and things are really tight and things hurt more when we try to move. But actually, if you move gently while you're healing, the collagen will lay down in long strips in the shape of the movement. And so it'll actually increase range of motion in the long term and make it easier to move. Also, when we move, our muscles need oxygen, so our heart pumps more oxygen to the area, and it can actually bring nutrients and oxygen to that healing bone and help it to heal more quickly. So why do we use restraints here? You guys can tell me. You use them with people.
So don't get up and fall down.
That's right. So it's really important. We want everyone to be safe, but we also want everyone to be mobile so that they can do their own ADLs independently. So it's a toss-up. The IH policy is limited use of restraints, like very, very, very limited, only in extreme situations. And that's because restraints actually increase the risk of falling. So that may sound ridiculous because you're like, well, if they're restrained, they're not going to fall. But in fact, the only way to increase your balance, your ability to balance, is through practicing it. So when people are restrained, it actually prevents them from practicing trunk control and getting up and down in the sit to stand. But as you say, we need to make sure people are safe. So what kind of measures have you put in place to make sure people can be safe without being restrained?
Chair alarms.
Chair alarms, exactly. I'm not sure if that's the only thing. Is there anything else? Chair alarms, bed alarms, and then somebody upstairs was saying talking to them and explaining to them what to do. So when you have a patient who's really confused, sometimes we may think, you know what, this person isn't going to understand what I'm saying, so talking to them isn't going to do anything. With some people, that is true. But I actually have a hip fracture patient right now at the hospital who is also very confused, very poor memory. But what I found is that by repeating and repeating and repeating, now she's starting to get it. So instead of saying, don't you move, don't you get up on your own, things like that, I would say, okay, I want you to move, but only with somebody. So how are you going to do this when you have to go to the bathroom? And then she'd say, I don't know. So I'd say, use your call button. When you have to go to the bathroom, what are you going to do? I don't know. Use your call button. Okay. And then at the end of my session, I'd say, okay, what are you going to do when you have to go to the bathroom? I don't know. Use your call button. Here it is. Pretend using it. Okay. And then one more time I would say it. And actually after the third time, I read the nurse's notes the next day, and she had used the call button to call to go to the bathroom in the night instead of the bedpan. So even I thought, oh, I don't know if this is working, but actually it did. So through repetition, sending people the right message is really important too, because we want them to have the motivation to move, but we want them to do it in a safe way. So restraints gives them the idea that it's dangerous to move and you shouldn't move around, and that's not the idea that we want to give to people. So Jen is the RA here, and she was saying if you have a chair alarm on someone, when you hear that chair alarm, yes, you will have to run to get to that person, but that is actually allowed. And I actually have confirmation from Lori that nobody will get in trouble and nobody will get fired if someone falls because of the chair alarm and not using restraints. But actually it's encouraged to help people to get this idea that movement is good and to let them practice standing up. Because people want to stand up when they're motivated to stand up. That's when they have to go to the bathroom or when something they want is across the room. They're not motivated to stand up when they're laying in bed and they're relaxing. So we need to use those moments in time to encourage them to move more when they're motivated. So if we do restrain them and we don't let them get this idea that getting up is good, they may never walk again. And I'm sure if you worked here for some time, you've seen people come back from the hospital, that's it for the rest of their life. They're in a wheelchair, they're dependent. And that also taxes out all of you guys too. So you have so much to do all day, and then the more immobile patients you have, the less time you have to even take care of everyone. So in the end, like, more risk now, but it actually works out in the future. So final thing is how much pain is safe. Some people get worried about, pushing people to get up because they feel bad and they think, oh, they have so much pain, maybe they should rest some more. But if you get their baseline of pain, you ask them how much pain they have now, make sure they move themselves a little because they might not have pain at rest. If it's 0 out of 10, when they're walking around, it can increase to 5 out of 10, and that's still totally fine. That will reduce as soon as they stop moving. So that would be the yellow light. pain that increases to about 5 out of 10, or if they already have 4 or 5 out of 10 and it increases by 2 more, that's a safe level as well. So this is where improvements happen. When they have some pain and they have some shortness of breath, but they're actually still doing it, that's when their body's going to make adaptations to improve itself. Easy zone is fine, something that's very easy for them. Maybe it's pain relieving for them. We can do that as much as they want. This zone we also want them to be in. And then you'll know if you're in the red zone and you should scale back. If someone gets pain, the pain lasts or increases for more than a couple hours after you stop moving. It's there overnight, they start limping more, they lose function. That's when you know that it's too much and you should scale back by at least 25%. But it's actually pretty hard to get into that zone. I wouldn't expect too many people to be getting in that zone just by walking down the hall. So, any comments or questions?
As you were talking, I was just thinking of our lady Doris with the pelvic fracture and how much pain she's in. And she loves to walk anyways, so she's walking all the time. Great. But there was a time last week or the week before where it hurt no matter what she did. Lay down, sit down, walk. And it was hard for her. I don't think she had enough pain medication at the time. Nurses were working with the doctors to try to fix that for her so that she could walk around.
Yeah.
And every time she did feel bad, she wanted to go back to bed.
I know, she was.
It's hard to keep her up.
That's the thing, yeah. And at the very beginning, that's gonna be something that's the real big challenge, is that pain control. But as you see, she has pain, but she still wants to walk around, and she's fine. So that's a really good example for the rest of the people.
But 2 weeks ago, it was quite difficult. Her pain was not in control.
Right.
And no matter what she did, it was bad. So it's better now.
Good. And that's normally how it goes. The first, week or so is really difficult, even longer for some people. Good. Well, just a summary. The more they're encouraged to move, more increased falls risk now, slightly more pain now, less falls and less pain later. They will improve sooner and faster, so although it's really hard at the beginning and you can see how much pain they're in, the more that they move, the sooner they'll get better. Better cardiovascular health, better function. They may be able to still do their ADLs in the future. Lower mortality, better quality of life, and less work for you. So I'm sure everyone will fill up your day with things anyways, but at least you'll have a better chance of getting everything done. So thank you for listening.
Thank you.
Thank you.